Hello, my name's Pat, and this is my husband Brian. I suffer with osteoarthritis. About 16 years ago, I had an arthroscopy in my left knee. I was diagnosed with osteoarthritis in it. And then about 10 years later, it happened in the right knee. The same thing happened, diagnosed with osteoarthritis in that. You couldn't offer me anything else except that was it. And then a few years later, my left knee played up again, and I went for an MRI scan, and I was told there was nothing they could do for me. I wasn't severe enough for a knee replacement, and so I was just left in the dark. I had to suffer with now and again limping about, trying what was over-the-counter things to knee supports, seeing if they would work. And then one day, being members of Bupa, a leaflet came through the door talking about AposTherapy, and I showed it to my husband, and he says no harm in trying it, there's nothing else around. And I came, started in 2009, and with the first boots, and gradually it started to improve, and I would have to say it's the best thing I've ever done. My knees, we've been on a 5-week holiday, and I've not had any trouble with my knees. They've got better rather than worse, and all I can say is I hope it continues that way, and that knee replacements are in the future rather than in the past. What would you have to say about it?
Well, with that is that up to October 2009, prior to that, when Pat started before she started the Apos treatment, if we just walked along the street just shopping, she would have to hold on to me, and she'd be limping. And after about 3 months, we went on a holiday to a hotel that we probably shouldn't have gone to, because it was built on the side of a cliff with so many steps and stairs, and it was only really towards the end of the week when you did sort of say something about your knee hurt a little bit. That was the first time you commented on it, and at no time were you holding on or anything. So that was after about 3 months, and it was only then when you realised the improvement that the treatment had actually made, because it was quite extreme, where we were and what you had to do. And whereas I think prior to the start of the treatment, you just never been able to do it. So I think that's how at least I noticed it so much.
And you wear them so naturally in the house. You get the exercise, just wear them a few hours in the house. You're unaware that you're wearing them, and carry on life as normal, and I'm able to go out shopping with friends without having to worry and start limping or anything like that. I can enjoy life, and not able to run like I used to, but or dance, yes. But I can walk the rest of the life with my grandchildren, which I've done for the past 3 or 4 years. Never dreamt I'd ever be able to do that, and that's quite an achievement for me. I'm pleased, and I hope it carries on that way.